Many New Haven area parents with disabled adult children say other parents should not fear privatization following the layoff of hundreds of state workers. Good evening, I'm Ann Nyberg.
And I'm Scott McDonald. These parents say their sons and daughters were doing well with the privatized services. And Chief Political Correspondent Mark Davis spoke with those parents about their children's experience. He joins us live tonight with more. Good evening, Mark.
Hi, Scott and Ann. Good evening, everyone from the Hartford Newsroom. Now, the governor says that using private providers for this kind of care more is a national trend, and he's right about that. And many parents that we spoke to today say their kids are on this and they're doing well.
25-year-old Carl Arazzini now has his own apartment in New Haven. With help from a nonprofit health agency called Marrakesh and the Chapel Haven Day program, Carl is doing quite well. He is from a musical family and plays the cello every day. His parents say they are very pleased with the help he gets from the private, nonprofit agencies that serve him through the State Department of Developmental Services. They say they sympathize with the parents who spoke out earlier this week, fearing that the layoffs of state DDS workers will be difficult for their adult children.
Carl has many staff at Chapel Haven and he's had changes with Marrakesh, and he's thriving.
As a mom, I can certainly feel their apprehension and their concern and their worry. Change is very frightening to anyone.
And Sue should know. She has 4 adult sons, ages 32 to 52, 2 with severe autism, that have all transitioned from state-operated facilities to private nonprofit providers.
Another son moved out of a hospital step-down unit and is in a private provider placement where there's round-the-clock nursing, and he's doing very well.
Justin is more independent than some of these other folks that you've been interviewing the families of. He's had a lot to navigate, but he lives independently in a studio apartment.
The sad thing in Connecticut is they're being starved. They haven't had pay increase in like 7 years.
Now, the governor's office says after this latest round of layoffs at DDS is completed, which is the end of this year, the beginning of the new year, and many of these clients are transitioned to these private care nonprofit providers, that the state should save about $70 million. Live from the Hartford Newsroom, Mark Davis, News 8.